Hmm. Yeah, I'm looking for it. I don't see it yet.
You don't?
Mm-mm.
Uh-oh.
I don't see it. Here we go. It just literally just popped up.
Really?
Yeah.
Okay,
cool.
but
Yeah.
you're okay? You
Yes,
see
sir.
the
Yep.
stream starting soon?
Yep. Yeah, it just literally popped up as soon as those words left my stupid mouth. Hey, all. Just running a little bit late.
It's Carl's sister-in-law. That's Christina Marie. Hello, Christina. You're good. All right, let's get this infernal noise machine turned off. Uh-oh.
Discontinue all comfort measures.
Yeah, sorry.
It's all good. Just talk fast.
All right.
Shorter shows in the summer.
Can't. These are still 51 or 50 minutes and 10 seconds.
Yeah, I think as long as we get.
Now, if we want to do separate everything, then we can do shorter shows for you.
Don't do it.
You know what I mean? Okay, you're rumbling somewhere. Somebody's rumbling.
I was rumbling. I was mumbling to her.
No. I
Oh.
mean, that's not what I meant. You're when you type, something's rumbling. Check your mic and make sure it's not making contact with its cage.
I think we're good.
Would it be because it's touching the computer?
Oh yeah. Oh yeah.
Watch out,
There you
your
go.
water's behind there. We could have a total disaster.
Yeah, just don't have anything touching the boom other than the boom.
Duh.
Goddamn genius.
Not helping. Retiree.
Sorry. I think I'm an asshole now.
Yeah, that's okay.
You used to be sweet, and then you retired. Now it's like,
When was that?
Miss. I get. I think I'm just going to go on a vacation tomorrow. I think probably.
Okay, OBS is acting weird. Yeah, there's a lot of rumble.
I swear I don't hear anything.
Oh, I know what it is.
It's not you, Scott.
Hang on.
Is this on?
No, but it was bouncing off the wall behind Scott. It's still on. I just turned it down. There you go. All right.
As I said, discontinue all comfort measures.
I know already.
Okay. Cardiff's already starting up. Everybody say happy birthday to Mr. Cardiff, by the way. It's his
Happy
today.
birthday.
We're going to do that on the show.
Okay.
Okay. You all ready?
Let's do it.
You got some articles to talk about? I didn't even ask.
Yeah.
You brought those ones?
I can fake it.
Oh, God, please don't fake it.
Oh, I can do it. I can do it.
All right, here we go.
It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my inevitable woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show. Oh, we got Tacey, too. Hi, Tacey.
Again.
Yeah, no, I didn't
Hello.
forget. You're quite delightful.
It's nice to be remembered.
It's my partner in all things, Tacey, everybody. This is a show for people who had never listened to a medical show on the radio. If you have a question that you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347.
Pooh head.
Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And I want to throw a shout out to our friend Cardiff Electric, whose birthday it is today.
Happy birthday.
And we'll talk more about him on our podcast and possibly very soon on our Patreon. He has quite the story to tell. So, Cardiff Electric, everybody. Check him out on Twitter at Cardiff Elect. Uh-oh. Better see what this is. Oh. Well, and there he is. Hello, sir.
I just wanted to see if you would answer the phone while you were doing your show.
Of course. Why, I would always take a call from the esteemed Cardiff Electric, the owner of our podcast network and famed creator of the SJ Army.
Time is money. Get back to work.
Okay, sir. Thank you.
That's funny.
Son of a bitch. All right. Check out Dr. Scott's website at Simply Herbals. Did I say that?
Yep. But you can say it twice. It's
All right. How's everything going with that?
pretty well.
Yeah.
Pretty well.
Okay. Well,
Selling some good spray.
always full of lots of information. Thank you, Dr. Scott.
Oh, hell, if I say too much, you bitch about it. I don't say that, you bitch about it.
Well.
Lose, baby.
That's right. That's
But-
what
but
this
thank
is.
you, though.
This is a lose
Lose.
situation.
It sure is.
Hey, well, at least the temperatures are going up in here pretty quickly.
Yeah,
at
it
least,
is.
At least we got that going for us.
Yeah, it's 1,000 degrees in the Weird Medicine studios, and we had it's Dr. Scott and I
or
installed.
the closet, as I like to call
It's
it.
not a closet. We are all sitting very comfortably in here with a large 8-foot table and mixing boards and cameras and everything. But you can call it whatever you want.
It's
to.
where my Christmas tree should be.
Probably true. But Dr. Scott and I installed a new air conditioner up here, but we haven't finished the job yet, and we haven't fully insulated. So as soon as I turn the air conditioning off, the temperature turns up to 1,000 again. And it doesn't matter Kelvin or Fahrenheit or Celsius. When it's 1,000 degrees, it's hotter than
Yes.
shit.
And thank you to Becky and Jerry for the
Yeah,
unit.
and they don't listen, so they don't care.
No.
But thanks for the shout out. Dr. Scott, you've got some stories for us today, I believe.
I have a couple.
Okay.
I figured we started
Very
out
good.
with
All right.
something that I felt was kind of shocking.
Okay.
Electric shock to penis may cure premature ejaculation, a study says.
Okay. So is this like the Ludovico technique from, well, I'm going way back. So if you were
you're ahead of us.
born in the 50s and you watched the movie Clockwork Orange, you would remember the Ludovico technique where they used aversion therapy to keep the guy Malcolm well, that wasn't his name on the movie. God, now I can't remember anything. But to keep the guy from committing crimes. So they would show him films of horrible crimes, and when he would get aroused, then they would give him medicine to make him, vomit, as we would say in Tennessee, and they wouldn't let him close his eyes. But the bad thing is that the soundtrack to it was Beethoven, so they also, conditioned him against Beethoven. So I can just imagine you've got some spouse who is pissed that her partner, his partner, has premature ejaculation. So now you hook them up to this shocking thing and say, now try to shoot in 30 seconds and see what happens to you. I think that would work. You know what I mean?
Oh, I do. Yeah,
It's a long way to go around to that. I mean, it's not a joke exactly,
No.
it. I'm not Tom Myers. It's I'm not setting up a joke with 14 paragraphs, but I just imagine that sort of aversion therapy would actually work for that. But I'm assuming that's not exactly what they're doing here.
No.
Okay, so what is it?
Aversion therapy seems like it would have quite an effect.
Well, I'm coming. No, you're not.
No, you're not.
Yeah.
Yeah, I think it's probably, and that's maybe where they got this. Anyway, researchers found, they were in Lebanon. They found that men roughly last 7 times longer in bed after undergoing electric current therapy. In a recent study published in the Journal of Asian Journal of Urology, reported about how by giving electric current or TENS unit to the dorsal penis nerve,
the dorsal nerve being the one that runs along the top.
Yeah, that's
if your penis is sticking straight out from your body, the dorsal vein and the dorsal nerve are pointing at the ceiling,
kind of like a dorsal fin.
And there you go.
Like a fish.
Exactly.
Yep. And that's so what they're doing is they're putting effectively a TENS unit on that and shocking it, because what they found is that's the nerve that's responsible for the input of movement and sensation,
which turning it down.
Yeah, which actually makes sense. Yeah, so it's very
decreasing its sensitivity.
Yep, and it, you know what, Dr. Steve, it's a lot like those dorsal column stimulators they use for pain. That
to shut the nerve off. Yeah,
or at least provide another sense of stimulation to quell that storm.
Gotcha.
Doesn't actually turn it off completely, but it just kind of quells it. But so they did a study on this 28-year-old guy that was climaxing after 40 seconds of sex on almost all occasions.
God, he was going that long.
That's what I said. What's the complaint there? Get it over with, for God's sakes.
Yeah.
But after being in a relationship for more than a year with his girlfriend,
and still shooting
and doing it twice a week, you would have thought he would develop some sort. You would have thought.
We're going to talk about non-shocking ways to take care of this, but go ahead.
But after they did this TENS unit on him, and that's exactly what it is. It's a TENS unit. They actually have shown that it can increase his length of not reaching premature ejaculation by up to 40%. So
40%?
Yep. So
wait a minute. So he was going 40 seconds.
Yeah.
40% of 40 seconds would be 16 seconds, right? Yeah. So now he can go 56 seconds.
Right, but now after multiple therapies, now after multiple therapies, he's making it 3 full minutes.
Oh, okay.
So that's pretty
Which
good.
is enough.
Yeah, hell yeah. I mean,
Tacey would love it if I were built that way. Wouldn't you? I mean, you kind of are a fan of the quickie, right?
Yes.
Yeah.
Oh yeah.
And I was always a fan of the marathon thing, and it's been interesting trying to reconcile that, because she's hardwired for the quickie and I'm hardwired for a marathon session. And it's anyway.
Well, but
she loves it when we talk about our sex life on this show.
Yes.
But a lot.
I'll say no more, but I'm just saying it can be a challenge for couples.
Yeah. But they actually may have gotten some of this concept. Sometimes handicap paras, if they want to try to have an erection and actually have children, they'll actually put a TENS unit on these penises for people who have spinal cord injuries, and they can actually get erections.
Really?
Yeah.
Interesting.
Yep.
I'll have to read about that.
Yep.
That's
it's a it is a therapy that they do on occasion.
I am interested in getting the electro shockwave therapy for the corpora cavernosa. So those are the spongy parts of the penis that fill up with blood and give you a nice meaty erection. I mean, at 66, it's not, I heard a comic explain it once that when you have a really good erection, a cat couldn't scratch it. It's very descriptive to me. And I'm not quite at the cat couldn't scratch it anymore.
Right.
It's still nice and, firm, but I would like to have that. And I wonder if I did that electroshock therapy, if it would improve that. What do you think, Tace?
I don't know.
There's only one way to find out, Dr.
She
Steve.
doesn't care.
She could care less.
Couldn't care less.
It's a
do whatever with your stupid
whatever.
penis.
Yes. Put it in either hand you want, big boy.
That's
That's
exactly right.
That's right.
Well, again, we've gone downhill, and we've been doing it for about, 4
Okay,
minutes?
so yeah. Well, you're fulfilling your role. Over
Hey, we
there.
can, we can change it. All right, you want one more?
No, I'm interested in this. So,
Oh yeah.
So this is a thing, but it was this study had an N of 1.
Oh hell, I didn't read any further than
Although
that.
you said they did it to one guy.
Yeah. Well, that's the only one they reported on.
Yeah, that's we need a larger study.
So
for
here,
that.
but here, if you read down the further, and the average man lasts 5 to 7 minutes rolling around the sheets.
Those are pikers.
The good news is this TENS unit, or as we like to call it, electric shock therapy, it does cost less than a lot of the medications.
I'll tell you one that's free. I mean, you're right.
Yeah.
People
But
can
those are expensive.
People can take Prozac or fluoxetine, or other SSRIs, and it will.
Then they won't
one
get
of
an
the
erection at all.
Well, one of the adverse effects is delayed ejaculation, and for some people, yeah, you're right,
Or none at all.
is erectile dysfunction. So that's kind of dicey, but I can teach people how to fix premature ejaculation. If you're out there and you have premature ejaculation now, I can have it. If you'll do this, I can have it fixed in about a month most of the time.
Yep.
And if you can't, then yes, go seek help from a urologist or a a physician that specializes in diseases of the sexual nature, or of sex organs. But this is what you do: you go on Amazon, go to stuff.drsteve.com, and just what you want is a gel masturbator. And what this thing is, it's like a fleshlight, except way, way, way cheaper than a fleshlight. But it's basically, you're looking for a fleshlight that doesn't have some model's vagina on it. I do not understand fleshlights. Do you get this at all? Apparently what they do is these porn or adult film stars will take a casting of their external genitalia, and then they will put that on a fleshlight. And when you buy it, you're like buying, Scarlet Star's, vagina.
Wow.
Except, to me, all of the fleshlights look exactly the same.
Yeah.
And, it's just the trappings on the outside, the packaging. It's all marketing, I think.
Mm-hmm.
And even then, it's like, who cares what it looks like? It's not, they're not there. Anyway, so I don't get it. But you're paying extra for that. So don't pay extra for that. Just buy a generic gel masturbator and get some water-based lube, not the warming stuff. I'm just warning you. Don't get that stuff. And also, don't have intercourse after you've been cutting up peppers to can them, and then it's all over your hands. And then you take the lube and you put it on your hands and then kind of lube yourself up and then go at it, because not only will your penis burn like fire, but your wife's vagina will too. I just heard this.
Yes.
I'm just saying.
I believe that was the last time, and it's been about, 3, 4, 5 years?
It's horrible.
I'm
Anyway,
kidding.
That'll teach him.
don't do that.
That'll teach him.
Oh, you mean the last time we had intercourse? And okay, I get the joke. Okay, I get it. I'll give you. Like John Melendez's DC trip. At least you tried, Chase. So anyway, so get the non-warming lube. You want water-based lube. Don't get silicone-based lube. It will eat this thing up. Mm-hmm. Now, what you want to do is you put this thing on a table that's about waist high. And this is the simplest way to do it. If you try to do it in bed, it's very difficult.
No.
But put a towel under it, and then wrap the towel over it. And then what you're going to do
is you warm the towel first.
No.
It just goes on and
up.
on.
No, I'm going to teach them how to cure their premature ejaculation. I'm doing a service here. So I just don't want them to run into any problems.
Sure.
So now the point is that you fix this thing on the table with your hands or with this towel, and hold it down so that you're fucking it. You're having intercourse with it. You're not holding it in your hand and jacking it up and down. Okay, does that make sense? And so what you're going to do now is you're going to simulate intercourse with this thing until you start feeling that tingling, like oh God, it's coming. Guys can tell when it's coming before it actually comes. So if you screw up and you ejaculate into this thing, then just chalk it up. I'm going to stop a little bit sooner next time. Let's say it's 30 seconds, and I blew my load. I couldn't stop myself. So next time you're going to go at 25 seconds. You're going to withdraw, and then you're going to take your hand and you're going to grip your erect member, and you're going to put your thumb over the urethral meatus and press down. Not too hard. You don't want to bruise it. You're just going to press down, and that will almost 100% of the time stop that feeling that you're getting ready to blow your load. Okay, and then after it's completely gone, you reinsert and you do it again.
Where did you get this information?
Honey,
is this happening in my house?
No. Do I have premature ejaculation? No.
Urology.
Your complaint is exactly the opposite. So no, they taught us this in medical school.
Okay.
And then the gel ejaculator part was my innovation, but this works because what they teach you to do in medical school is to do this with a willing partner. Now, not every partner is going to be patient enough to do this. So I'm getting people started in a situation where there's no shame, no nothing. They can just do this on their own and then show their partner how much they learned when they come home. Do show and tell. So anyway, so now you've gone like 30 seconds and you pull out, you put your hand over, and then you keep, and it's basically called edging. You're just edging, and you get close to the edge and you continue to do this. Now, this may take you a month of doing this 3 or 4 times a week, but what you're going for is each session that you have, the first time that you pull out hopefully will be longer than the amount of time it was the time before. So if it was 30 seconds the first time, then it's 45 seconds, and then it's a minute, and then it's 2 minutes and 4 minutes, and then you can make it go as arbitrarily long as you want to. Now, you want to do this with a partner who's aware of what you're doing so that they can do this with you. So now you should be able to insert in a vagina or whatever. There's no judgment here, whatever your partner has, and go for 2-3 minutes. And then if you want to go longer than that, you're going to pull out and have them hold your penis with their thumb over your urethra. And what they taught us in medical school was to start with that. I think that's wrong, because how many partners do you know are that patient to work with somebody that has premature ejaculation, to do this time after time after time? Yeah, see, it's not really going to happen, particularly in 2022. We're very, we just want to get things done quickly. And I think doing it with the gel masturbator, you're going to get quicker results, and you can do it more often. And if you're doing this with your partner, getting them to do it twice a week is probably going to be a stretch. With this, you could do it every night if you wanted to, and just practice edging and go longer and longer and longer until you can have intercourse without withdrawing at whatever arbitrary limit you've set. Because premature ejaculation just means that you've ejaculated sooner than you thought that you should. For some people, that could be 20 minutes. For other people, 7 minutes. Other people, 3-4 minutes. So, okay. All right?
Got it.
No drugs. But it is more, it's more labor intensive to do it this way. Although you could argue it might be more fun than attaching a TENS unit and shocking your dick into submission.
Yes.
Okay?
Yep.
All right.
Very reasonable.
Very good.
All right.
What else you got? That was a good one.
Yeah. We'll change pace here a little bit.
Okay.
How about when we need PA John here for?
Well, he's not here. So.
No, I know. But no, there's a new painless wireless wearable gadget which sticks to the skin like Velcro, measures your blood sugar, which we already have, but also the alcohol and muscle fatigue at the same time, which could be a game changer for diabetics. And part of the cool thing is that this will actually help you to monitor your blood sugar on the fly, and then if you're drinking alcohol, you can actually tweak the amount of medicine you need.
Interesting.
Yeah, it's kind of cool. So it's brand new.
What they'll do with this is they'll make us wear it, and then they'll wire it to our car so it won't let us drive if we've been drinking.
What company makes that?
Let's see.
I mean, I don't drink and drive, but I would be pissed if my car just went, nope.
CWS.
Oh, I don't.
Maybe. Yeah.
Okay.
Yeah, it's kind of cool. So
That
they're
is
just
cool.
now into some trials,
Okay.
very very early. But gosh, you think about for this type 1 diabetics, this would be a wonderful thing.
Yeah. All right.
It's Aquil X is the startup company that's got this.
Okay. Well, we're not recommending the people
No.
invest in it or anything.
No.
No, I'm just saying. Well, we have to say that.
I was just interested.
Yeah, I'm interested. That's fascinating.
Yeah.
Anything else?
Nah.
We need an artificial placenta. We need an artificial pancreas until
Yeah.
we have. So an artificial pancreas basically would just read your blood sugar and then give you insulin at the correct dose to maintain a normal blood sugar. And we're getting close to that. We have sensors that will read your blood sugar, and then we've got devices that will give you insulin at the same time based on that reading. But PA John had one, and he found it to be a little bit annoying in that it would wake him up at 4 a.m. if the sensor just fell off, and it'd tell him, oh, your blood sugar is 0 and stuff like that. So we got to perfect that. But artificial placenta would be a big deal because, I worked in the NICU in training, and, these babies come out at, 24 weeks or whatever. It would be really cool if you could just take their umbilical cord and hook it up to a placenta, put them in a vat of saline, and just let them finish growing there rather than trying to maintain them on a ventilator with all the things that go along with that, the retinal dysplasia and stuff like that. And it's very difficult for the preemies in the way that we try to resuscitate them and keep them alive during that period of time. So, artificial pancreas, we need artificial placenta, we need... What else?
That would be pretty cool.
Artificial retina.
Yeah.
That would be cool. We've got the artificial cochlea, or we've got the cochlear implants now. So these are all things that we, artificial skin, like Data had in, was that First Contact?
I don't remember.
First Contact, when Data, the Borg queen, was trying to seduce Data, and she gave him a little patch of skin on his arm, and then he could feel. He had actual sensation.
Cool.
Anyway, yeah, we need that too. We need lots of stuff.
Yeah, we need lots of things.
All right, are you done with your stories?
Yep.
Okay.
Number one thing, don't take advice from some asshole on the radio.
All right, very good. Thank you, my friend. Oh, here's kind of the opposite, or not opposite, but it's related problem this person had. Let's see if we can get it.
Hey, Doc, it's Steve from Texas. I got an embarrassing question for you.
Okay, man.
Since I turn about 40, whenever I'm banging my wife,
Yeah.
it seems like I don't complete the transaction and I lose the boner about once out of every 2 or 3 times that we do it. And I don't know what's going on. Like I said, I'm 40. I walk every day about 8 miles, so I'm in pretty good shape and pretty good condition. But anyway, let me know. Thanks.
Yeah, man. So the question is, does he have delayed ejaculation, or is he just losing his erection halfway through? Sound like he had a little bit of both. Or when he says he can't complete the transaction, is he not ejaculating out the end of his penis? Because that's another thing.
Oh, yeah.
So people that have a normal orgasm but do not ejaculate are having retrograde ejaculation. That's 100% of the time what that is. And that is often caused by certain medications or trauma, or it could be diabetes. And they've got some neuropathy down there, and basically it's just fluid dynamics. Fluid will go through the path of least resistance, and the path of least resistance should be from the seminal vesicles and the prostate out the end of the penis. But if you've got some increase or decreased tone to the sphincter going to the bladder, you could actually have a pathway of least resistance going into the bladder. So what they're doing is they're ejaculating into their bladder. The other one, though, is... Sorry, I'm having a problem here. Hang on a second.
Oh, you stopping?
Yeah, just for a second.
That's cool.
Sorry, everybody. I don't know why this is doing this. God damn it. Why? Okay. Well, I've lost a complete window here. Oh, I bet I know I can bring it up. Hang on. There we go. All right. Sorry, everybody. Let's see where we were. And now this computer's fucking up.
No.
Okay, sorry. Then you've got people who are just losing their erection halfway through. That happens.
Sure.
And that's basically erectile dysfunction. Erectile dysfunction doesn't always have to be that you're not able to get an erection. It can be that you can't maintain one. And later on, as it marches backward in time, you'll end up not being able to get one.
Right.
So not being able to maintain an erection requires a workup. I would check your testosterone, see if you're on any medication that could be affecting things. Make sure that your blood pressure is okay and you're not diabetic, those kinds of things.
Yeah, just a good workup, CBC, just to check all of those numbers. Yep.
Sure. And then if all that checks out and you're able to masturbate to completion 100% of the time, but you're not able to to complete the transaction when you're having actual intercourse, that could be psychological. There could be something that's you either got pressure to perform with your partner and that causes you to be taken out of the game, or for whatever reason your partner's turning you off in some way. But it could be, or there's something, you're having weird thoughts during sex that you're not having when you're masturbating. So we usually will ask people that, can you masturbate to completion 100% of the time? But if you can't, then that talks or, pushes you in the direction of something being more physiological.
Yeah, more medical, sure.
Yeah.
I agree.
All right, so get that checked out. Let us know which one of those it is. And then we'll go from there. Now, the third thing could just be delayed ejaculation. I wondered if that was what was going on. It was just taking him longer than normal.
Well, and if they're doing it often enough, he loses that sensitivity to a certain degree, too. And that's not uncommon.
But, some men with delayed ejaculation need 30 minutes or more of sexual stimulation to have an orgasm and ejaculate. And it some point when you get a little bit older, you just can't go 30 minutes anymore.
Hell no.
And then you just go, fuck it.
Oh.
You know, forget about it.
Who's got time? I ain't got no time.
I
for that.
gotta go. Goodbye. Anyway, so, and the question is this, excuse me, a lifelong issue, or is it an acquired issue? Did it just start happening? And him, it sounds like it's something new.
Sounds like it is something new for him. Yes.
And then again, is it generalized or situational? And that's what the urologist will ask you. Mm-hmm. And those are the kinds of things that they will, will explore. So, depression, anxiety, medications that treat either one of those. Mm-hmm. Again, relationship problems with stress or performance anxiety, poor body image, if you have any sort of cultural or religious taboos, or differences between the reality of sex with your partner and your sexual fantasies.
Oh.
So that can do it, cause delayed ejaculation.
This doesn't sound like what this guy has.
No. Now, antidepressants, blood pressure medicines,
yeah.
diuretics, antipsychotic medications.
Prostate medications, those alpha blockers will do it too.
Alcohol.
Alcohol will do it, yep.
So get that stuff checked. Look into it. Let us know which one clicks with you and let us know.
It's a pretty complicated
We
thing.
want all of our listeners to have fine, satisfying, sexual relations. All right. This is one Tacey and I did.
Hi, guys. This is retired pharmacist John calling back.
Hey, John. Tacey and I did this on the Patreon show, but he wanted to hear it, and he's too cheap to get our Patreon, so he called back. And I said, what the hell, we'll do it here, too.
Hope everybody's doing well.
Yeah, man.
Oh, yeah.
Yeah, man.
Oh, yeah.
I had a question about choosing a doctor in the sense of what's the sweet spot? Do you want someone just out of medical school? Do you want someone with 15 or 20 years experience? Do you want an old guy like me that's been around the block and seen it all? About 2 years ago, I was thinking about having surgery for my prostate cancer, and ended up choosing radiation, which worked great. But the doc who was going to do the surgery, when I asked him how many he had done, he said 10. Well, I decided I wasn't going to be number 11.
Fair enough.
Just curious on your thoughts on that.
Someone's got to be number 11.
Everyone's
now.
well. Enjoy the show.
Hey, thanks, man.
Thanks so much. Take
That's
care.
great. Hey, thank you. And I'm going to be joining you in retirement, hopefully soon enough.
Woo-hoo.
What do I got? 5 years?
I'll believe it when I see it.
Yeah, me too.
Yeah.
I think Tacey's the only one.
I can't wait.
Tacey's the only one.
I haven't
that's
touched my
retirement
music studio in so long. I just don't have time. So I definitely want to do it. But we got to get Beck through school. It's listen. If you're listening to me right now and you're thinking about having kids and you're thinking of waiting, don't. It's not that I would have been a terrible parent if I had had kids when I could have as a younger person. But to have your first kid at 48 and your second one at 50 is insane. And I'm 66. I have a 17-year-old at home, and I got to get this kid through college.
I still remember the day when you found out you're pregnant with number 2. It's like we were doing the math. We were in that old clinic we were in.
Oh yeah. I remember you were there.
Oh damn! I'm like, oh hell, you're gonna be like a papaw.
Yeah.
They're gonna say, hey papaw.
Oh, that happened to me. Believe me, all the time. I used to take Liam to Walmart every day because where we lived, that was about
the only place,
the only entertainment we had. So I'd go to Walmart, and I would take him in his carrier. And back then they had greeters. And the greeter would go, "Well, here comes Papa bringing the baby," and it's like you keep saying that.
I love it.
But anyway, yeah, even then, here comes Papa. So so have kids if you're thinking about doing it now. There's no good time. Oh, we're going to wait till there's a good time to do it. There's never a good time. Just do it.
Always an excuse to not have.
Rip the Band-Aid off. It's the greatest thing you'll ever do. It's the most creative thing you'll ever do. And if you do and it's your first time, email us or go to our website at drsteve.com and click on the link that says one-page baby manual. It's a one-page baby manual. Tacey and I met with these experts, and she wrote it all down. It's all her work, but I just the raw thing and made it into electronic form and put it on the website. And it will walk you through the first year of diapers and sleeping and feeding and all that stuff.
All of it.
And then I took Dr. Karp's book, and I'll probably get a DMCA on this, but I took his book, which is like 250 pages, and took the whole book and distilled it down to 5 lines. Because in that whole book, it's called Happiest Baby on the Block. It's a good book, but it's everything that's in there of value is 5 lines, and everything else is filler. So he came up with a cool idea, wanted to publish it, and then wrote 250 pages just to pad it out. So it's all there. So check it out, drsteve.com, and click the link that says one-page baby manual. But anyway, so what are we talking about?
We're talking about how you pick a physician.
Oh yes, thank you. So yeah. So the sweet spot. Where is the sweet spot? There isn't one. So George Foreman always talked about a boxer. When they get older, they lose their speed, but they always gain their power. They always have their power.
As long as they keep working out.
Well, yeah, that's right. Oh, I know where you're going with this, and that is brilliant. I'm going to give you this ahead of time. Because I know where you're going with that. That's right. But so they will lose their speed. So I don't have the speed, the mental agility that I did when I was fresh out of residency. I was hot to trot, ready to go, knew everything or thought I did. But as I get older, I feel that I have less mental agility, but I've got way more power. My ability is much higher than it was back then. And if I needed to do a diabetic ketoacidosis, I could figure it out. And if I had to do a bunch of them, I would be really good at it. But I retain my power and have increased my power, but my speed, my quickness is gone. Now, Tacey's alluding to something that's analogous to working out. Go ahead and talk about it, because you worked with a lot of doctors,
a lot of physicians, not all of them. I mean, it's just like in every career, people get lazy and they don't keep up with the new information.
Yep.
Or the newest thing, and the newest thing isn't always the best thing, but at least you know about it.
Right.
And there are a lot of reasons for that. They're overworked and...
Well, they're lazy.
But there are lazy ones that don't. And so that would not be a good one. You could talk to your pharmacist. I think your local pharmacist would know.
Yeah, this is a pharmacist calling us. Who would know better than a pharmacist?
Well, I mean, he's retired.
Okay, fair enough.
But, I mean, so... you don't want somebody who writes all the new medicines, because that's going to cost you a fortune, and not all new medicines are the best.
Yep.
But you don't want somebody who writes
nothing but
50-year-old medicines,
shitty generics
all the time.
That are 50 years old.
Yeah, and if you got to know, some of the pharmacists are even thinking. Yeah, they're some of the pharmacists are even thinking, man, I wouldn't go to this guy.
Right.
I got to order this shit. It's so old.
Yeah, and I think the pharmacists would be good at telling you who's bad. I don't know that they would be the best at telling you who's good. That's the thing.
Yeah.
They know who sucks.
Yeah.
They really know who sucks, but I don't know that they could then from there discern who is really good amongst all the people that don't suck.
Yes, and then word of mouth.
There you go.
Which I know is what you were going to say.
Give yourself a bill.
Yeah.
Stole it from you.
That's fine.
Because a lot of, our neighbor one day said, my physician never touches me. Well, that's problematic.
Yeah. Well, if they
you're
need
there
to
for
touch
a physical,
you. Yeah, right.
and you don't get touched.
Yeah.
I mean, or you're not, listened to.
If it was her psychiatrist, that's actually a good thing.
Well, yes, that would be extremely weird. I don't think I've ever physically touched my psychiatrist.
Well, that's
in
the way
any
it should be.
Yeah, I mean, not even
But if it's her gynecologist,
poked him.
Right.
Yeah. Yeah.
If it's her gynecologist, then that would be ridiculous.
You got to ask around, because people know. Oh, I used to see this guy and he sucks, but now I see this guy and he's great.
Yeah, and one physician sucking may be someone else's good physician too. So you got to get the context. well, he wouldn't give me no Lortabs.
Yeah.
That's not necessarily means that he sucks.
No, that probably means he's good.
Yeah.
I mean,
what do you think, Scott? You've been awfully quiet in this. How do you tell a good acupuncturist from a fucking nut?
Exactly what Tacey just said.
Yeah.
Word of mouth, yeah, and get multiple words of mouth, not just one.
Yeah,
because one person may have a terrible.
Get the context.
And figure out why they had a terrible experience, but starts with education and making sure they have all of their ducks in rows, and then word of mouth. Yep.
How do you tell an acupuncturist from someone that just did a 2-week class or a weekend class in acupuncture?
You would have to be on the nccaom.org, which is the
what?
It's a national board for
NCCAOM.
Yeah, .org.
What does that stand for?
I don't know. National Commission for.
You don't know?
Hell, I don't know. I wasn't expecting this question.
Look him up.
I was taking it.
I found it.
I was listening to Tacey.
National. You were just looking at her tits. This is National Certification Commission for Acupuncture and Oriental Medicine.
Yeah, it's a national site, and that way you can actually look if you have one in your neighborhood, and you want to see if they have credentials, etc. Then you can actually find them.
Okay, well let's do 25 miles from my zip code, and let's see if you come up.
Yeah,
I want to see who comes up on
Probably
here.
Not.
Oh my God, because you didn't pay your money. Oh, you're not. You're not on here.
I am the smart.
There's a reason for that.
Well, there's a bunch of people that are on here that don't have your qualifications.
No, I know.
What's that about?
Hell, I don't know.
They can get on this thing and not be a diplomat of Oriental medicine. How do you find those?
If they went through a Chinese medical school program and they're like an LA.
These are people in our town. I've never even heard of these people.
Oh, I know. That's why you've got me, old buddy.
So okay, now this really makes. Okay, so you recommended this website.
Yeah, I know.
There are people on here that I know must have done a weekend class. So how do I discern? Yeah. I go to this and there's 20 people. How do I know which is the
We
one
need
I
to erase the last 4 or 5 minutes.
Why?
Yes.
Because what he said this doesn't work.
Oh.
well, to a certain degree. It does.
Well, no, I'm just asking the follow-up question.
Well, but what I would say first of all is if you go to somebody and all they do is dry needling.
Yeah.
That's not the same as what we do practice medicine. If it's a chiropractor.
Well, then you got to go to somebody and then find out. Is there no way to pre-screen these people?
Lord, I tell them to call and make sure. Yeah, call. And if they don't have a website,
and what questions should they ask?
Well, ask them where they went to school. Ask them what their degree is. Ask them if they went through a 4-year Chinese medical school program. Or if they just did a weekend warrior. I get very, very, very upset with some of the knowledge that's passed on by other medical professionals that say, oh gosh, it's a challenge, and that. Of course, we've been battling this for 20 plus years. So
yeah, because there are lots of people out there that want to practice medicine without a license.
Yes.
And the thing about Dr. Scott that I have said multiple times, he took 4 years out of his life to go to traditional Chinese medical school. Mm-hmm. So it was 4 years of medical school, and he does a different brand of medicine, and we can, make fun of certain things that Dr. Scott says in here.
Sure, of course.
But he could make fun of things. If we were on an acupuncture podcast, he would be making fun of me because I'd be saying stupid things to them. So, but the one thing I can tell you about Dr. Scott is he's very conscientious. He doesn't do things that aren't in his scope of treatment, and you can tell that 4 year of medical school, plus you did like an internship or something too, right? Mm-hmm. Yeah, and his 20 years of experience doing clinical traditional Chinese medicine, it's way different than somebody that just took a class.
Yeah, and they just do some
because I've watched you at work,
yep.
And 100% of the patients that I send to you come back telling me at least they feel better.
Yep.
He's on it, Steve.
I actually went through there and found it's got my full name Steve. It's got my legal name.
Well, who knows?
You're not on it from 25 miles from my zip code here.
Yeah, no, I am. Yeah, because I put it in there myself.
Dude, I just did it. Okay.
I'm looking at it right here. He's on it.
Okay, don't say the zip code.
No. But I'm telling the boss is here, and she's second to my
I believe
emotion.
you. Okay, let me see. Maybe I'm at the wrong website.
Yeah, it's my
Okay, I'm doing 25 miles from your zip code, and let me see. There you are.
Yeah,
now I see.
Yeah, my legal name.
I had no idea what your legal
now,
name was.
you know what's weird on this is it. Yeah, no, I did, but you weren't on the search that I did.
Yeah,
but that's fine.
Sure.
But it doesn't differentiate you. It doesn't say you're a DOM. Mm-hmm. It just has your name. Mm-hmm. But there's a diploma next to you. Let me see what happens when I do that.
And that's an old website too.
Okay, what's AC certification?
Oh, that's just the acupuncture.
And CH certification?
That's Chinese herbal medicine.
And OM?
Oriental medicine. Yeah.
Okay,
yeah.
So if you click on this thing, let me see what. Okay, this person only has AC, so you would only be getting acupuncture from that person.
Yeah, that's correct. Yeah, they
I got
the medicine part. Yeah.
Okay, now I think this website's okay.
Yeah. I apologize. I should have done a better job. Yeah.
You apologize.
Well, it's not like you look yourself up on the internet.
No, hell, I need to fix.
Now here's a guy here that says, okay, nobody cares. No. Nobody cares. Check out that website. It is nccaom.org. And then look at those diplomas on there and make sure that they've got all the things that you want. Anyway, that's interesting.
Yeah.
Interesting to me. Don't know if it was interesting to anybody else. All right. Let's see here. I don't know what this is. This person called in, and I'm not sure what's happening with this. Let's see if this is.
Hey, Doc. This is Zach from Oklahoma.
Hey,
or
Zach.
The movie Messiah in the waiting room.
Okay. Hey,
I had an
Messiah.
interesting topic I thought you could talk about on the show. It's called the Mariko Aoki phenomenon, and it refers to what happens when people enter a bookstore, any kind of bookstore, and all of a sudden they have a sudden urge to poop, go number 2 to the bathroom. And apparently, like a lot of people have this. I've had it and just didn't really know about it. But I recently came across this article, and it was such a big thing that the Japanese did a study on it and found out that thousands of people have this. They don't know why, and they tried to, equate it to like smells of ink and paper, or if that has some kind of effect on the bowel system, or if people, they go to read when they're on the toilet, so maybe it's a psychological effect. Yeah. But they never did come up with an answer. So I just thought that this was interesting. It's Mariko, M-A-R-I-K-O, Aoki, A-O-K-I, phenomenon.
Yep.
And I just thought that was something cool you could talk about on the podcast.
Yeah, absolutely. That's fascinating. Mariko Aoki, Gensho, Japanese expression referring to an urge to defecate that you suddenly felt after entering a bookstore. Have you ever had that?
Never had that.
Who goes to bookstores anymore?
They've got cool stuff in bookstores.
They do have cool stuff. They have to. They
especially the old bookstores that have the old books. They're pretty cool.
Yeah,
I don't think I've ever had a poop walking in one.
No, there was a great bookstore in Chapel Hill that I really liked. That I bought lots of stuff in there. I used to love to just browse around.
Yeah.
And now it's just all Amazon, and I download shit to my Kindle.
And you feel like you have to poop when you get on.
I do.
Amazon
I mean,
store.
I read my Kindle on the toilet.
All right, theories. All right, let's hear some theories. Who has a theory?
Well, one theory includes that the smell of paper ink has a laxative effect. That one would be easy to test, or as he said, the association with reading on the toilet at home. But I do tend to read when I'm sitting on the john. But I never ever have that associated with any other place that I go. What are you laughing about?
I'm laughing at Sean. He feels like it when he has to go to work. Talk like egg to you when she goes to Pier 1. So
now, one thing I have noticed though, have you ever had the urge to defecate, and then when you get closer and closer to the bathroom, it gets worse and worse? Maybe you were in your car and it was stable, for a while until you get close, and then you're ripping at your belt, and if it gets stuck you're like, oh my God,
or zipper gets.
Am I going to be able to hold it? Have you ever noticed that? That's a real effect.
Well, it's really bad with I've just heard this 40-plus-year-old women who are starting to have overactive bladder issues.
Yeah. We don't know anybody like that.
No. But, someone I know was at a concert recently, and there were 3 porta potties, and the line was like 30 minutes long. And if you have this issue, you have to decide, am I going to have to go in 30 minutes?
Mm-hmm.
Or
think ahead.
Yeah, you've got to think ahead because there's no warning time.
Yeah, and if it's urgency, you can't plan 30
minutes.
Yeah,
you cannot.
You stand in line.
Yeah,
well,
no.
And that's the same thing with if
just
you have an enlarged prostate. If you have an enlarged prostate, it's the same thing.
Right.
You just get that urge. It's like, oh, God.
If you're at a concert, just piss on the person in front of you.
Oh.
No.
Or
if you're a woman, just piss, on your inner ankles.
I'm sure there was plenty of that going on.
Down your leg.
I mean,
but the thing that Tacey was referring to at this concert that this friend of ours went to, when you walked, there were so many people pissing in the woods
that you would have been peeing next to somebody within
and then waving at them.
10 inches from somebody else.
It's dark. They're wearing sunglasses.
No, it wasn't.
Everybody's drinking.
It wasn't dark.
It wasn't dark enough.
And also, you're walking through other people's piss, too, because they're pissing everywhere.
Yeah.
It's getting all over you anyway, and it's multiple people's piss at that point.
Yes. So, lots.
Yeah, if you want to...
Piss here, piss there, piss everywhere.
If you want to deal with piss, go to an outdoor Jimmy Buffett concert, because everyone's drinking beer.
Yep. Goes right through you.
Yep. And then... Anyway,
Now
that friend of ours that went to that had an interesting time at that concert. All right,
great time.
One other theory is that, then this is bizarre, the psychological hypothesis that the effect arises from feelings of nervous tension in the face of all the information represented in the bookstore.
I don't believe that.
I don't either.
No. I think the smell has...
It's got to be that.
I think the smell certainly has.
I don't believe it acts as a direct laxative. I think it's some psychological effect.
And I've never noticed if bookstores have bathrooms or not.
Nope. I have no clue if Books A Million has a bookstore because I've never had the urge to defecate in there.
Nope.
Of course, legally they have to, but
yeah,
if they have patrons.
Yeah. So the reason it's named this was apparently named after a woman who mentioned it in an article, and she just happened to be Japanese. So now it's named after her.
Oh, good.
It says the Mariko Aoki phenomena received considerable coverage, even with one of Japanese leading magazines, Weekly Bunshun, being quick to feature the topic in its May 2nd, 1985 issue. And the reaction was so considerable as an ordinary young woman who had divulged this concern regarding the delicate topic of her own defecation urge. This poor woman happened to mention it, and now it's named after her from, time immemorial. So, all right. Well, thanks, everybody. Thanks to Dr. Scott. Thanks, Tacey.
You're welcome.
Thanks to everyone at SiriusXM whose steadfast support of this show has sustained us over the years, particularly Lewis Johnson, Jim McClure, Sam Roberts, James Norton, Travis Teff, Troy Hinson, Paul Ovcharski, and Roland Campos. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. All right.
Cool.
There's that. Do some podcast action.
I think Kim Chickens gave me an idea of what may be the underlying cause.
Okay. Well, what we'll do is we'll hit. You want to do that right now? We'll do it on the podcast.
We'll just finish it on the podcast. Yeah.
Okay.
I'll wrap it up.
Okay, let's do it. Let me bring up the podcast script here real quick. She got a good one?
No, she doesn't know.
She doesn't have a good one. Okay.
No, but she does. She doesn't know what she triggered in my my brain.
Okay. All right. Hang on. Okay. Let's see. Okay, we'll start from there. You okay with that?
Oh, yeah.
Oh, shit. All right, you ready?
Yeah.
Okay. It's freezing up. This is a brand new computer. Why is it doing this? Okay. Anyway, so Dr. Scott, you got any other hypotheses?
I've got it. I think Kim Chickens kind of gave me an idea when she was talking about
in the waiting room.
In the waiting room, yes. She was talking about having coffee and going to work, and
Yep.
then having a place to go to the bathroom. But you know what?
At work?
At work, yeah.
Oh.
Yeah, no.
You go to the bathroom at work?
You're supposed to get up early enough, have your coffee at home, and do your business at home. Or Kim, we know that.
There's nothing worse than that.
But you know what? Most of those bookstores have like coffee shops in them.
That's true.
So people go in and they smell the coffee.
That's
They
exactly
drink.
right.
They drink the coffee. 1, 2, 3. There you go.
You think that's what it is? It's
I think
the
it's what it
coffee?
is. I think it's the coffee smell. Because most of those Barnes and Nobles and Books a Million, those guys have Starbucks inside them.
Well, this was first described in like 1950. That surely they didn't have book or coffee shops and bookstores then.
I'll bet they did. In Japan,
In
they probably
Japan, maybe,
had probably tea stores. Yeah,
all
yeah.
right.
I mean,
well,
hey, that's my hypothesis. I'm
that's
sticking
a
to it.
reasonable hypothesis.
More sense than anything
Sounds crazy
else.
to me. I can't relate to it at all. So, is a subset of people. Anyway, all right.
Thank you, Kim.
You're good.
You're good.
Got anything else?
Thank you.
Nah, I believe I'll do her.
Well, we can't forget Dr. Scott and Tacey. Thank you for being here. We can't
Why,
forget
thank you.
Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, that Gould girl, Lewis Johnson, Paul Ovcharski, Chowdy 1008, Howdy Gooplunk, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower, the Dolly Museum Diddler, Percy Dumb, Roland Campos, sister of Chris, Sam Robert, she who owns pigs and snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's double Steve Tucci, the great Rob Bartlett, Vic's Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Talipes Equinovarus, producer Chris, look it up, Jenny Jingles, the inimitable Vincent Paulino, everybody, Eric Zane, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends GVAC and Fez Watley, whose support never went unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website, drsteve.com, for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.
Thanks,
Thank you.
Stacey. All right, now let's do the start. Yeah, we're not done. Sorry.
Almost. They're
Steve,
good.
when are we going to do Patreon? Because,
Next Saturday.
I'm not here next Saturday.
Oh, you're not?
No, I go on the cruise.
Oh, and Anthony will be mad if he misses you because we have Anthony next weekend.
I can do it this.
Could we do it on Friday? When are you leaving? Oh,
I'm not leaving on Friday.
When are you leaving?
Saturday.
Oh, really? Let's do it Friday then.
Okay.
Okay, I'll call him. That's his day off anyway. So, spoiler for everybody, we got Anthony Cumia on our Patreon coming on very soon. So we will have the big three, and what I would like to do is cut up comments from each one and put them together like they were back together again.
Sounds like a lot of work.
It is a lot of work, probably not worth it. All right, let's do the opening.
What bag likes hot water? Tea bag. I find it hard to trust mermaids. There's something a little fishy about them. What's the name of the knight who started a food delivery app? Surcharge.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain now and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner, gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hey.
This is a show for people who have never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website. It's drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, massage therapist, proctologist, Zydeco musician, or whatever. Oh, very good. I left Zydeco musician in because we had that Bob Thibodeau call in, and I need to just get that off of there. That was a joke for him, and nobody remembers that. I do. Check out Dr. Scott's website at simplyherbals.net, simplyherbals.net, and check out stuff.drsteve.com for all your Amazon and your online needs. Please go to stuff.drsteve.com. It keeps us going, really makes a huge difference. And then check out our Patreon, where Tacey and I do a Patreon, and it's fun. It's patreon.com/weirdmedicine. It's content you won't get here. We had Jim Norton on. We've had Greg Opie Hughes. We've had Mark Normand and Joey DeRosa. And each one of them talks about some diverse thing that was totally different than we thought they were going to talk about. So that's been fun. And we've got some special surprise guests coming. Like Jim Norton came on, and you guys talked about 90 Day Fiancé.
A little bit, yes.
That was fun. Mm-hmm. And we talked about some other stuff like hairy ass cracks and how to keep them clean and things like that. Joe DeRosa came on and just talked about depression, which I thought was fascinating because he hung in there in New York City when everyone else was leaving and opened a new food place in the middle of a pandemic. Which I thought was kind of ballsy.
Oh, yeah, it is. So, way to go.
Yeah. Considering how he and I started out in this realm, go Google Dr. Steve versus Joe DeRosa, and that was the first time we ever had any interactions with each other. And from there to, the point where we're actually friends. And, every once in a while he'll just call me just to talk, and I'll do the same. And that's, he doesn't just call me for medical questions. So it's
he's a nice guy.
He's the nicest guy in the world. And really enjoyed him. And so we've enjoyed everybody we've had on. So check that out, patreon.com/weirdmedicine. The other thing I wanted to say was happy birthday to the owner of our network, Mr. Cardiff, a.k.a. Cardiff Electric. Check him out on Twitter at CardiffElec, something like that. And he is an interesting guy. He is a true online surrealist, and I appreciate that. I find him extremely entertaining, and You know, it's getting. Have you ever liked a band, but you liked it before everybody else did, and so everybody, you know, so you kind of, you know, were ahead of the curve, and then all of a sudden everybody else likes that band, and then you're like, ugh, you know. So I liked Cardiff Electric. I appreciated his talent, I think, way before other people saw him for the talent that he is. And now he pulled off a prank that I'm not going to go into now, but it was genius. It was pure genius. And now everybody's like, "Oh, Cardiff Electric's awesome." I'm not at that point where I'm like, "Oh, well, you know, it's not cool anymore." He's still cool to me, but I'm actually very happy that other people are picking up on the surreal nature, because you could, you know, we went to the Dali Museum. He was an old school art surrealist, right? Well, Mr. Cardiff is this kind of has the same talent, except it has to do with things on the internet. It's hard to explain, but anyway, you'll go check it out now, and then you'll go, Dr. Steve's a fucking idiot. But I'm just telling you that he is a genius, whether you recognize it or not. And my friend Murray, who was also a genius, he made a comment once that the more biting the satire, the narrower the audience. So Mr. Cardiff's work is very biting indeed, because his audience is pretty small, maybe an audience of one, but I really do appreciate him. So happy birthday, my friend.
Happy
Glad
birthday.
you're out there. Yep. All right, there we go. We're done. Let me save this, and then I'll put it together later. Nice tribute to our friend Mr. Cardiff.
Can I turn this thing off?
You can if you want to get out of here.
I do.
She's got an appointment.
Oh yeah. You need to go. Oh well, you've got 27 minutes.
I got 27 minutes, but I have to pee there. We really need to talk about overactive bladder.
Okay, yeah, we can talk about overactive bladder. You can bring up questions. You know, it doesn't have to just be other people, or you could call in. You know, that'd be funny. Is if you called in and said, "I can't ever get your attention otherwise, so can you talk about overactive bladder? You want to do that?" Yeah. Okay. 347 Pooh Head. Let's see. What's the recording?
Today, May 11, 5/11/22.
Recording. Okay, what are we gonna play? Anybody in the waiting room have anything that they want to discuss?
Colin Carnes.
No, there's no Russian agents in there. That was weird. We had actual Russian agents in the chat room.
What?
Yep. Those guys that were giving Lydia shit, they've never been here before, never been here since. The only difference was that we put, you know, we're going to talk about getting relief to Ukraine on there. Then all of a sudden there were these people in there, you know, calling her names and stuff like that. They had to be.
All right.
Hey,
All
we
right.
got a couple.
Thanks, Tace.
See you, Tace. Love it says going down the road feeling bad. Colin Carnes talking about a song about, and I love the drive-by truckers. Late for church.
Late for church. Okay, I'm in. Sounds like a good one.
Yeah, I love the DVTers. Do you want to?
Do you know the song? Because we can't actually play the song on here.
No, I'd have to listen to it.
Okay,
because I can't.
We'll work on that for next time for sure.
Yeah, I love drive-by truckers. That's a good call there. We'll have a. Kush just talking. You know what he?
Richard Kish.
Yeah, I'm calling Kush.
Oh, you call him Kush because you make marijuana jokes.
Because he's got good Kush. He says, "You know what he wants to hear."
What?
I don't know. That's all he said.
Fractured by King Crimson. Yeah,
shit,
I might be able to do that 20 years from now.
We I mean, we can try that if you're going to do the high part. You want me to do the electric mandolin?
What?
You get the
No, regular mandolin's good. I think our talent lies in being more acoustic. What are we gonna do?
Do you want to do that wake up song?
Yeah, I'm not 100% ready for it, but we could try it.
You got to sing it though.
No.
You got to sing the high part.
No, I can't do that.
Did you get the drum machine ready?
No. No, but I bought a new one just for in here.
Oh, cool.
It's going to be better than this little one that I've got.
Oh, no, that's a little fast.
Yeah, it is a little fast. Why is it doing that?
That's a little quick. A little quick. Oh, Lord. I don't know if y'all can hear that. If you can hear it.
What, that? They can hear that. I don't know why it's doing that. Let me see. What the fuck is going on here? There we go.
Phew. Woo. That's painful.
Okay, we playing that?
No. I was just warming up. Whoa. You know what I'd love to play is Tangled Up in Blue.
Okay, do you know it?
It's just G. Early one, early one morning, the sun was shining. I was lying there in bed. Wonder if she'd changed at all, if her hair was still red. The folks said that our lives together sure were gonna be rough. Never did like Mama's homemade dress, that banquet wasn't big enough. So we'll do. It's a GFC. The whole way. 1, 2, 3, and. Make it last on that.
Yeah.
Uh-oh.
Oh, shit. Okay.
Oh, double shit.
All right. I don't have to get out till 5:30, but I got to get out at 5:30. Okay. We'll be done by then.
Yeah, we'll just play one.
Okay.
All right, guys, we're on time crunch now. Whoops. I think she can get around me, but I'm very comfortable moving my car. But I'm very comfortable moving.
All right.
Let's do Tangled Up in Blue.
Is that the one you were just doing?
Yeah.
Okay.
Let's do it. It's just old Dylan standard.
Yep.
We'll just go nice and slow, nice and slow, nice and slow.
All right. Go.
Oh no, hell, I'm trying to find the damn. Hey, doing my best. All right. Early one morning, the sun was shining. I was lying there in bed, wondering if she'd changed at all, if her hair was still red. Folks said that our lives together sure were gonna be rough. Didn't like Mama's homemade dress, Papa's banquet wasn't big enough. D. I was standing on E minor on the side of the road, rain falling off my shoes. Do what? Do. Yeah, it's a.
Okay, you gave me 2 chords, but then.
Oh, I didn't know it changed.
So D.
I didn't know it changed until it screwed down there.
Okay.
Yeah, D, then E minor. Yeah. And that's really, and then it goes back to falling on my shoes.
Well, what is that?
A G. And then back to C. I'll just call out for you.
No, it's okay. Just if we can just, if I just know the structure of the song, I can play it. But
give me E minor.
D,
yeah, E minor. Yeah. G, C.
How many times did it do that?
Then one more. D, G, C, D. And hold it right there. And then it's F, C, G. Tangled up in blue.
No, it's not F, C, G. Okay, but we're gonna play it. We're gonna play it slow, though, right?
Yep.
Okay, you're not. Okay.
No.
I'll catch
Just follow me. You can noodle it. She was married when we first met, soon to be divorced. left her out of a jam, I guess, but I used a little too much force. Drove a car far out west, as far as we could go. Abandoned way out west, split up on a dark North of Green, it was best. Sorry about that, dude. She turned around to look at me as I was walking away. Heard her say over my shoulder, we'll meet again someday. I never knew F tangled up in blues. There you go. There you go. I had a job in the Great North Woods, working as a cook for a spell. Never did like it all that much, and one day the axe just fell. I drifted down to New Orleans, happened to be employed, working for a while on a fishing boat right outside of Delacroix. All the while I was alone, past was close behind. Said a lot of women, and she never escaped my mind, and I just grew. Uh-oh, we unplugged and deaf. Tangled up in blue.
Sorry.
That's okay. All right. Hey, we're good. We're on the fourth verse. We're halfway through. She was working in a topless place, and I stopped in for a beer. Just kept looking at the side of her face in the spotlight so clear. Later that evening when the crowd thinned out, I was about to do the same. She was standing there and looked at my chair and said, "Hey, don't I know your name, D?" I muttered something under my breath as she studied the lines on my face. Must have meant I was a little uneasy, and she bent over to tie the laces of my shoes. Tangled up in blue. There we go. She bit the burner on the stove and offered me a pipe. Thought you'd never say hello, she said. You look like the silent type. She opened up a book of poems and handed it to me. Written by an Italian poet in the 13th century. Every one of those words sang true when she clothed them in the burning coal. Poured off of every page like it was written from you to me. My soul tangled up in blue. I lived with them on Montauk Street in a basement down the stairs. Music in the cafes at night and revolution in the air. He started dealing with the slaves and something inside of him died. She had to sell everything she owned and froze a ball inside. And when finally the bottom fell out, I became so withdrawn. Only thing I knew how to do was keep on keeping on like a bird that flew. Tangled up in blue. So no, I'm going back again. I can. How? All the people we used to know, they're illusions to me now. Some are mathematicians, some are carpenters' wives. Don't know how it all got started, I don't know their lives. But me, I'm still on the side of the road, heading for another joint. Always did feel the same, but it's all from a different point of view. Tangled up in blue. painful. That was painful starting off, but we finished not too terribly bad. Yeah, it was just letting that C hang out there.
Yeah.
Hey, we need more. Stephen Bulls Creek. We need more bass.
What?
Stephen Bulls Creek. We need more bass.
No,
Yeah,
I'm already overwhelming you.
We need more bass out of that game. It's a great tune. Yeah, sorry we butchered the first 6/7 of it. Yeah, it's because we never played it before, and I picked something that was hard. I'll have to challenge Dr. Steve.
That's not hard.
Nah, it's not hard. You want to try that wake up real quick? We got to get out of here for.
Yeah. We're okay. We have 13 minutes.
All right, let's do C. All right, so it's
Okay, hang on.
Yeah, this is for. Is Sean still? Well, we're not gonna do it if Sean's not there. Is Sean? Are you still here? Is Sean still here? Sean, are you here? Something filled up my heart with nothing. Something told me not to cry. But now I'm older, my heart's getting colder, and I can see it's all a lie. Children, wake up, hold your mistakes up before they turn summer into dust. If children don't grow up, our bodies get bigger, but our hearts get torn up. Just a million little gods causing rainstorms and some thunder rolls. I guess we'll just have to adjust. Whoa. This is you. Out and touches my hand. Fuck that up. One more time, yep.
better look out below. One more time.
Yeah. One more time. Yeah. There we go. That's terrible. That was awful.
But we can work on it, though.
It was fun, though. That damn Sean had better been. He better been. Hey, there he was. He was there. Yeah, man. Look out below. Yeah. Sean says, "Look out below." You're right, brother. Yeah, that's what you call the first take. Don't pay any attention to that one.
Yeah.
But at least it was fun. So thank you. So we'll do that.
There's Patty in there. I see Patty. Hello, Patty.
Okay. We're yeah. Believe it or not.
Patty should come see you.
Oh yeah.
Yeah.
I was just saying, believe it or not,
you can help her.
Kim, this is a shocker. Kim and Sean both knew what song that was.
Really?
That's a miracle.
Wow. Uh-oh.
Hey, thanks, Kush. All right, so we got to do. All right, I'm ready to start. So we'll do.
Yeah, it was one of my favorite albums too, Kim.
We'll do that Drive By Truckers next time.
All right,
boys and girls, we got to get out before Tasty shoots us.
Yep.
We got to move our
she has
cars.
to leave in 8 minutes, and we're so uncoordinated. It'll take that tong. Take that tong to get there.
Yeah, it'll take at least
God,
6.5.
I'm turning into Cletus before my eyes.
You guys, thank you. Have a good week.
Yep, thanks.
Kim, go get some exercise.
Bye.
See-yins.
Shit onions.
All right.